want to speak to you about how to properly wear the post-op sling that I commonly put on after shoulder surgery. So we have our model here and we're going to take a look at this sling. So the reason we put people in this sling is because it has a pillow that holds the arm slightly away from the body. This allows air to get into the armpit so we don't get rashes, but it also takes some of the pressure off the rotator cuff muscle, which was typically repaired when you're wearing this. So this sling should sit about 45 degrees on your chest. It's not on your waist. So the pillow sits on women, it's right under the breast, on men right on the rib cage, and the arm should sit in the sling so the elbow is all the way back in the pocket. Many people come in and the wrist is hanging all the way out, limp, and it's going to cause wrist pain. So the elbow should be back. This little strap can go over to keep the arm in, and the waist strap comes all the way around the ribs, not the waist, and should be firm but not cutting off your breathing. The neck strap can be adjusted by both a Velcro in the back and a Velcro in the front, but it should be adjusted so that this arm is parallel to the ground. You shouldn't come into my office with your arm hanging like this or your shoulder cocked up. You can adjust these straps. You want your shoulder to be level with the other shoulder. You want the arm to be parallel to the ground, and it can sit on your ribs at 45 degrees. Your wrist should be in the sling, and this can kind of fold back or be adjusted as well. Some people like this little loop for their thumb. That can sometimes support the wrist. It's not a must, but if you like it. And this is kind of the correct position. Finally, rotator cuff surgery or other surgeries, it's important to keep your wrist and your hand moving. So from the very beginning, when your nerve block wears off, you want to open and close your hand, move your wrist back and forth and up and down, and you can use this little red ball to squeeze to keep the fingers strong and to keep the mobility there. Many people will get stiffness in the hand after shoulder surgery because the swelling can go all the way down to the fingers. So you don't want that, so make sure you're keeping your hand moving. The next thing I want to talk about is how to remove your sling safely to do your exercises. So typically, depending on your situation, 1 or 2 days after surgery, we can get some movement going in the shoulder and the elbow. The way to remove the sling safely without disrupting the rotator cuff is as follows. So we can detach the sling straps and bring it over the head. Then you want to tip your body forward and to the side. So now the arm is just falling with gravity away from your body. We unclip that, so stay to the side. So now gravity is holding your arm. Then we can slide the sling off and you haven't had to lift the arm. What I don't want is lifting the arm yourself, because that's pulling on the repair and can disrupt things. So gravity, and then once you're out of the sling, you can stand up and let your arm hang straight. Now when you want to put that back on, you bend your elbow. We don't lift our arm up like this. We tilt, and you can have somebody help you with this. And then we take the sling, slide the hand in the opening, and keep that elbow down. And then slide the sling back on, bring the strap over the head again, and do all the straps. So that's a safe way to do it. You're going to tilt to the side, slide it off, stand back up, tilt to the side, slide it back on, and do all the straps like we discussed before.